Our next speaker is Spencer Zhu. So Spencer is completing her Master's in Business Analytics here at UWA, but she actually joined the science team as an intern through the McCusker Centre for Citizenship. And Spencer has completed a really important piece of work for us over the past few months, helping us to track down the impact of the nearly 800 Raine Study publications on policy. And so she's going to share her presentation from research to policy, evaluating the Raine Study's impact on policy over 35 years. Off you go, Spencer.
Thanks for introducing, and next I will be sharing my project. This project aims to explore research analytics and metrics using Savile to demonstrate how research findings, evidenced in published papers using the Raine Study data, have influenced the global scientific community and policymakers, and finally contributed to the meaningful real-world change. So what exactly is a policy document? We may have varied understanding of this term, but here we have adopted the definition as documents written primarily for policymakers that are published by a policy-focused source. For example, the policy documents can be categorized as reports, guidelines, and also policy reviews. And what do we mean by a policy-focused source? They are organizations that explicitly aim to influence government policies, such as governments, NGOs, and think tanks. So how does the Raine Study fit in? Our researchers, using the rich longitudinal data, have produced research papers that are later cited in these policy documents. Through these citations, our findings have influenced the global scientific community, informed policymakers, and then contributed to real-world change. So how much of the real-world change we are actually talking about? To explore that, we used a classic framework from political science, the policy development cycle. It is proposed by Harold Loswell, one of the founding figures of modern policy analysis. This model can help us understand how policies evolve from an initial idea all the way through to the real implementation. And if we map the Raine's contribution onto this cycle, we can see how far along we are in shaping actual policy outcomes. Interestingly, around 80% of the documents are reports, which mostly appear in the early stage, focusing on problem identification and understanding the context. And also we have around 18% come from guidelines, which show up later in the cycle. These represent the policy formulation and adoption stages, where our findings are translated into practical recommendations or standards. And finally, we have around 2% there are policy reviews, which belong to the maintenance phase. So this indicates that our data is also being used to assess existing policies and guide their future development. And next is the core part of this project. Over the past 35 years, we have 234 publications that have been cited in policy documents. And if we look at the timeline, the peak period for policy citations were between 2016 and 2024. But when we take a look at when those papers were originally published, most of them come out between 2011 and 2021. So overall, there's a 6 years of lag between when a study is published and when it starts appearing in policy. Actually, that makes perfect sense because turning research into real-world impact, it actually takes time. And now let's take a look at who's actually citing our publications. As you can see, the majority of the citation come from government bodies. The state government of Western Australia leads the list with 41 citations, reflecting our strong local relevance and policy connection. But what's more interesting here is that our influence extends well beyond Australia. About 10% of the citations come from intergovernmental or international organizations such as WHO and OECD. So overall, our impact spans from local policy making to global public health sector. As we just talked about some of the international policy bodies, this chart can give us a clearer and more integrated view of where the Raine Study's impact is being felt by around the world. Not a surprise, Australia leads the way with 64 citations. Next is the United States with 52, and followed by the UK with 31. So we are not just nationally recognized, but is also gaining strong international visibility and credibility, especially in the US and various countries across Europe. Here we've grouped the citing policies based on their key themes. What you can see on this page are some of the most representative policy areas influenced by the Raine. To make our analysis clearer, we have aggregated all these topics into 3 broad categories, including health, society, and lifestyle. As you can see, health-related policies make up the largest share, covering areas such as nutrition, asthma, breastfeeding, mental health. And the second is society-related themes such as health service planning and gender equality. Finally is the lifestyle sector such as smoking, posture, and alcohol consumption, things like that. Next, we are going to look at 3 showcases to get a sense of how the Raine is creating real-world impact. The first example comes from 2020, featuring a policy on depressive disorders developed by an American institute. This policy, it provides a practical recommendation for how to evaluate and manage depressive disorder in clinical settings. It even includes a list of screening tools clearly labeled according to how strongly each one is recommended. What's important here is that a paper of the Raine in 2014 served as evidence in supporting this policy. And this paper, it links how low vitamin D levels to symptoms of depression in young adult males. The second showcase comes from 2023, which one of our papers is cited by the Michel Institute. The citing document is a national guideline on sleep health. It calls for stronger national action to improve Australians' sleep health and outlines a very comprehensive framework that includes raising public awareness, building better data collection and monitoring system, and also strengthening primary care capacity for early intervention. Unlike the previous example, which focused on a clinical practice, this one extends beyond the clinical setting, providing policymakers with a systematic, evidence-based framework for national health planning. And finally, the last one, it takes us from national frameworks to the international level. This example, it comes from a 2021 policy report by the OECD titled Measuring What Matters for Child Wellbeing and Policies. The report, it draws on a 2014 Raine Study publication that explored the link between dietary patterns and cognitive performance during adolescence. Building on that evidence, the OECD developed a policy framework for child well-being focused on how to build better data systems to measure children's health, development, and overall well-being. Also, the framework lays a great groundwork for more accurate and consistent measurement. It highlights key data gaps and provides guidance for future policy priorities. So similar to the previous example, this one also establishes a strategic framework, but this time it's more data-driven on a global scale. So after evaluating that the impact of the Raine Study research has had on policy, what becomes very clear is that we play a key role in moving from guesswork to evidence within a policy context. So that's pretty much of my project. And finally, I want to take a moment to express my sincere appreciation for being part of the Raine Study. And this internship has been a very inspiring and sweet journey for me. Thank you.